Hello, my name is Kelly Schmidt. I'm your instructor for D439, Foundations of Nursing. Welcome to a quick overview of Chapter 17, Analysis and Diagnosis of the Nursing Process. Diagnosis or analysis is the second phase of the nursing process. The registered nurse's analysis of assessment data is to determine actual or potential diagnoses, problems, and/or issues. The nursing diagnosis reflects the nurse's clinical judgment about a patient's response to potential or actual healthcare needs. Why is this phase important? Before a plan of care can be established, nurses must determine which nursing diagnosis applies to their patient. The diagnosis or multiple diagnoses helps nurses view the patient from a holistic perspective as a whole. Using a nursing diagnosis can lead to higher quality nursing care and improved patient safety. Care is based on the needs outlined in the diagnosis or multiple diagnoses. The diagnosis phase also helps to increase the nurse's awareness and can strengthen their professional role. In the diagnosis phase, the nurse follows a set of objectives that end with developing the nursing diagnosis or diagnoses used to establish the care for that patient. The first thing that the nurse needs to do is he or she must identify what problem the patient is experiencing related to the medical diagnosis. From then, we need to identify any risk factors. Any situation or problem that could result must be identified and addressed. We need to analyze the gathered data from the assessment phase. That data needs to be gathered, validated, and analyzed to support an appropriate nursing diagnosis. We then need to develop a theory or a hypothesis. This is an organized framework of concepts and purposes that guide nursing practices. The nurse's theory is a unique perspective about the patient's status and measures needed to improve the patient's outcome. Finally, we must establish the nursing diagnosis. So after we identify problems and risk factors, we gather and analyze data and we develop a nursing theory. The nurse can then establish a nursing diagnosis or diagnoses, which is used to establish the nursing care plan. What is involved in this phase? The diagnosis phase of the nursing process involves three main steps: data analysis, identification of the patient's health problem, risks and strengths, and formation of diagnosis statements. Data analysis involves the nursing clustering cues, comparing data against standards, and identifying inconsistencies or gaps in data. After the data analysis, the nurse will work with the client to identify actual risk and possible diagnoses. In this step, the nurse will determine if an identified problem classifies as a nursing diagnosis, a medical diagnosis, or collaborative diagnosis or problem. This is important and we must involve the patient in this step because it helps us to identify the client's resources, coping abilities, and strengths. We also need to create a nursing diagnosis, and the nursing diagnosis may have up to 3 components. The nursing diagnoses are standardized by NANDA. They are approved nursing diagnoses or nursing statements which define the cause of the diagnosis. Using patient-specific data to justify the diagnosis and statement. The nursing diagnosis is the patient's response to what is actually happening. You might be asking, how is the nursing diagnosis different from a medical diagnosis? The nursing diagnosis requires careful consideration of the patient's individualized problem, situation, and needs to develop appropriate nursing diagnoses. We can have some challenges. It could be a complex process to create a nursing diagnosis. Before we can come up with a nursing diagnosis, we must interview and assess the patient and review the data, which can be time-consuming. We need to try to make this process a little bit easier. During this step, you need to review all objective data, including vitals, lab tests or diagnosis tests, and subjective data. You can make sure that the patient's medical history is accurate and find answers to any questions that you don't have. The more information you have, the better. We may come up with another challenge and interpret data differently. The data that's taken at face value, such as lab or diagnostic lab results, are measurable, but subjective data is not measurable. It's information given to the nurse by the patient based on the patient's perception of what they are feeling. Nurses sometimes interpret this data differently from nurse to nurse. When this happens, it can create a challenge when developing a nursing care plan. So it is essential for nurses to have a clear understanding of which data is objective or subjective. As nurses, we must be careful that we're not using our own perception. Establishing nursing diagnosis should be a collaborative effort among the nursing team. Nurses that are assigned to the patient's care should discuss the perception of the data as a team to make informed decisions based on all data. What if we have insufficient data? If you don't obtain enough data during the assessment, it will be difficult to establish appropriate nursing diagnoses. So we need to review all data: subjective, objective, lab, diagnosis, test results, narrative notes from the patient interview. This is why performing a thorough assessment on the patient and making sure we interview family and/or caregivers is very important. We also want to make sure that any tests are readily available to review. If you've reached the point of the diagnosis phase and you don't have enough information, you will need to reassess your patient and ask additional questions. Lack of communication between staff. Patients are assigned to a primary nurse, but nursing is a team effort that requires communication and collaboration. When there is a lack of communication between nursing team members, information might be omitted or forgotten. This failure in communication makes getting a complete view of the patient's needs and status difficult, and we can make an error in developing the nursing diagnosis. End of shift report is an excellent way for nurses to communicate changes in a patient's status. Nurses need to make notes of anything pertinent before handing care off to the next shift nurse. We also need to clearly communicate concerns about the patient's progress or lack of. When you have a continuum of communication, we can ensure that the patient gets the best possible care. Once again, what's the difference between nursing diagnosis and medical diagnosis? While they do share similarities, nursing and medical diagnoses are different. The nursing diagnosis is used by a nurse to identify the patient's actual or potential risks, their overall wellness, response to a health problem, condition, or state. A medical diagnosis is used by physicians to determine or identify a specific condition, disease, or pathologic state. What is the meaning of NANDA? It stands for North American Nursing Diagnosis Association International. It's a professional organization that researches and develops, disseminates, and refines nursing diagnosis terminology. What is the purpose of establishing a nursing diagnosis? The primary purpose of establishing a nursing diagnosis is to communicate the healthcare needs of the patient among members of the healthcare team within that specific delivery system. The nursing diagnosis allows nurses to facilitate individualized care for the patient and family, and it strengthens our profession as nurses. Why is it important to form an accurate nursing diagnosis? The nursing diagnosis serves as the basis for selecting nursing interventions, which have a significant impact on patient outcome. If an accurate nursing diagnosis is not chosen, the plan of care and subsequent nursing interventions may not address the patient's issues, and it may result in a negative patient outcome. How do we rank the diagnoses? Diagnoses are ranked in the order of importance. Immediate life-threatening problems or issues related to survival are given the highest priority. For example, airway. A diagnosis involving our airway or our breathing is going to be more important than, let's say, a diagnosis of pain. Pain is very important, but airway or breathing is going to take priority. Thank you for joining me for this quick overview. If you have additional questions or would like additional practice questions, etc., please reach out. Everyone knows how to reach me, kelly.schmidt@wgu.edu. I hope you have a great rest of your day, morning, or evening, and I'll talk to you soon. Thank you.